first of all, thanks. We had a great opportunity, and I want to first of all thank Congressman Kine and Representative Shankland for being here discussing this Medicaid expansion issue with a large number of people from Portage County and frankly from around the state we're listening today. And AARP did a great job of bringing those people together. Once again, I hate to go back to polling because sometimes polling is wrong, but 70% of the people of Wisconsin in an independent poll said they want to have Medicaid expansion. And we heard today from lots of people exactly why that number is so high. So our goal here is to make sure that everybody understands the importance of this issue of having affordable and accessible health care. The people in the audience today certainly reinforce that for us and the urgency that we're having around this issue right now. So with that, I'd be glad to answer any questions to any of us.
Let me just quickly add, I want to thank Governor Evers and Representative Shankland for the leadership that they've provided our state as far as improving a healthcare system so all Wisconsinites have access to affordable, quality healthcare. Today, a lot of focus on bringing that Badger Care expansion money into the state. $1.6 billion. 36 states have figured out a way to do it. 16 states led by Republican governors have already done it. It's a nonsensical issue that we're not doing it here in Wisconsin. So we're going to continue to make this case, and we're going to need people to weigh in with their representatives to encourage them to do the right thing, expand Badger Care, cover the more vulnerable, more sensitive part of our population so that those costs don't ultimately get transferred onto everyone else.
Today we heard from people in Portage County and across the state that healthcare is a deeply personal issue to them and to their family members. We heard very personal stories about people's family members and themselves and how the Medicaid expansion would help them. The Medicaid expansion would cover 82,000 more people and save the state $324 million, but it would also benefit everyone by raising reimbursement rates so that our nursing homes can stay solvent in our local and rural communities, so we can support our frontline care providers and our workers in long-term care facilities. We heard a lot about the importance of making sure that everyone has access to these community centers, like especially rural community health centers. And we heard from people who are very worried about their family members and about the caregiving shortage. So this is an urgent issue, and that was what was stressed today. This issue is both immediate and urgent, especially because on Tuesday the Budget Committee will be meeting and the Joint Finance Committee will be voting on the Department of Health Services. And while it's notable that Republican legislators already took the Medicaid expansion out of the budget, they also have the opportunity to do the right thing. And something that was stressed repeatedly by members of the audience, the people who came because they care about this issue and are invested in this issue personally, is they want to make sure that every legislator does the will of the people, and we need to be making that an issue across the state. So I really appreciate that Governor Evers and Congressman Kine are here today so we can raise awareness about this issue and get everyone to contact their legislators and tell them to do the right thing by accepting our federal dollars and expanding Badger Care, the Medicaid expansion.
That's great. Questions?
Just off the bat, what is your message then to opposers of this?
Well, obviously the Republican leadership is in opposition to this, into this move. And my message to them is quite simple. We're not giving up. People of Wisconsin have spoken. There's a reason I'm standing here as governor. There's, we have somebody from the federal level, somebody from the state representative standing here talking about the exact same issues. 70% of the people are not wrong. We're not giving up on this issue.
I would add that this should be a nonpartisan issue.
Yeah.
I think it's in everyone's best interest to be able to expand coverage for those who have a difficult time getting it. We are taxpayers as well. That money is being sent to Washington. All we're saying, let's bring it back to the state of Wisconsin, put it to work here so we have a world-class healthcare system covering everyone.
How would you respond to concerns regarding the repealing of the Affordable Care Act in Congress and how that would impact your legislation here?
Yeah, again, that will impact the issues about pre-existing conditions right off the bat. And I'm one of those people. I'm a cancer survivor. There's 2.4 million people in the state of Wisconsin. That's a lot of people that have a pre-existing condition. So I think the ability to do away with the Affordable Care Act is just one more thing that, first of all, it's not going to happen, I don't believe, and second of all, it's clearly something that the people of this country support. And as it relates to the issue of Medicaid expansion, 75 million people in the country are covered by this expansion opportunity. We want to make sure that our state and our people in our state have the same opportunity.
During the public comment portion, it seemed a lot of the people that talked were from out of this area, not central Wisconsin. Are you concerned that maybe you're not hearing enough from the people in this area about healthcare, especially considering one of the state representatives didn't show up today to this town hall?
I thought, I'm not sure the makeup of the group, we only heard from a handful of people, but I think the fact that there were some people from outside of Portage County, I think that's an important, that represents what the Marquette poll said, 70% of the people, and that includes Republicans and independents and anybody else. So I think the fact that there was a good mixture, it was reflective of the importance that people see of this.
I'd also add, as somebody who represents Portage County and has for 6 years, I saw many constituents in the audience who were very excited to be there and who are thrilled that Governor Evers put Medicaid expansion in the budget. And earlier today, I was at the new coffee shop downtown, Ruby Coffee Roasters, and just getting my coffee, people were asking about the budget, they were asking about Medicaid expansion, they wanted it to pass, and several of my constituents who came to my office hours brought up healthcare, the cost of healthcare, and connected it to Medicaid expansion, understanding that it would help. So I do think it's an issue that we hear about all the time in Portage County, but for people who'd be willing to make a drive from other parts of the state to come here and hear the governor, that tells me how important this issue is, how significant it is to them, and how we need to keep fighting for all of them so they can have access to good quality and affordable health care.
We've got time for one more question.
Now, Governor, this is kind of unrelated to the healthcare in general, but is there a plan to increase hunting fees at all? I know Conservative Congress was talking about that.
Well, that's a possibility. The Conservation Congress is a strong, obviously, supporter, and we want to listen to the Congress's suggestions, but there hasn't been any decisions made on that yet.
Okay, so would you be in favor of that at all, or?
Possibly. We'll take a look at that. I'm not a big fan of fee increases, but if the Conservation Congress is making those type of recommendations, we'll sure look at it.
Thank you, Governor.
You bet.